Welcome to Durham County and congratulations on your pregnancy. Today, you will receive a brief orientation about what to expect during your pregnancy and prenatal care at our clinic. You will sign consent forms for your care and to share information among the clinic and the hospitals Duke University and Duke Regional. The nurse will review your health history paperwork and will answer any questions that you have. If your health history indicates any high-risk conditions or problems related to your pregnancy, she will schedule you an appointment with a high-risk clinic at Duke University. You will also be scheduled an ultrasound appointment at this same clinic. If you are interested in applying for WIC, you can fill out this form and take it to Lobby 2 on your way out of the building. Hand it to the receptionist and she will help you schedule an appointment and tell you what documentation you need to bring. I also teach childbirth classes and want to tell you about those. The whole intent of childbirth classes is to increase your confidence about your natural ability to give birth. This doesn't always mean medication-free, it just means that you understand what your body can do on its own. The more you know, the more you can make informed decisions about what you are wanting to do. Classes take place on Mondays, 2-hour sessions, 4 classes total. They are free to patients, but if you have Medicaid, we will bill your insurance. The nurse can give you one of these brochures, and if you look on the right-hand side of your brochure for the current schedule, you can visit the website to register. I like patients to register so I know how many people to expect. After you speak with the nurse today, you will go to the lab to do blood and urine tests to check things like your iron and sugar levels, as well as any signs of infection. The tests you would do today include urine culture, complete blood count, hepatitis B, HIV, syphilis, blood type, antibody tests, immunity to rubella, immunity to varicella, and sickle cell testing. If you have a family history of diabetes or an elevated weight for your height, you will also do an early sugar test to screen for gestational diabetes. If you are about 18 to 23 weeks gestation, you can decide to do a blood test today to detect the possibility of genetic disorders in your baby. This test is totally optional, and a nurse can explain this more to you if you would like. We will also test your blood lead level and screen you for tuberculosis, depending on whether you are at risk for any of these things. A few of these tests are optional, but recommended. With sickle cell testing, many people have been tested before and it doesn't change over time. The reason it's important to test is because if both parents have sickle cell trait, there is a greater chance baby would be born with the disease. We start with mom, and if you test positive, we would recommend that father of the baby is tested. In terms of HIV, women are tested at least once during pregnancy. It's a state law that testing must be done before a baby is born. If you refuse testing during pregnancy, they will test in the hospital while you are in labor. It's a good idea to test early in pregnancy because if we identify any moms who are HIV positive, we can start medications to keep mom healthy and prevent from passing HIV to the baby. If you have a sexual partner who you want to have tested for STDs and HIV as well, they can walk in, no appointment needed, to do express testing in Clinic 6. It takes about 30 minutes and is free and confidential. Results usually come back within 7 to 10 days. If you want to know a lab result prior to your next appointment, we will require you to come in so that we can verify your identity. In terms of your prenatal care, we have two different options for your appointments during your pregnancy: traditional and centering. With traditional care, you come in on a one-on-one appointment into the clinic like a typical doctor's appointment. You can have flexibility with your dates, but we can't guarantee that you will see the same provider. Centering, on the other hand, is group prenatal care. If you are enrolled into a group based on your estimated due date, you will meet with that same group of moms at every visit, same time, same place. For example, if your visits are scheduled for Fridays, they will always take place on Fridays, same time. With centering appointments, since they are pre-scheduled, you will keep the same provider. Centering can be great if you want to establish a relationship with the same person, same provider. Moms will learn how to take their own vital signs, keep track of their progress in their pregnancy, and each appointment includes some time learning about different topics. There are snacks at each visit, and we like to throw a baby shower and a reunion after all of the babies are born so they can meet each other. You get to know other moms while you're supporting each other in your pregnancies. We ask that you don't bring children to centering, but support people are welcome. Typically, I say it's best to begin with centering because if you don't like it, we can easily take you out and place you into traditional care. It's more difficult to take you out of traditional care and put you into centering because the group is closed after the 4th session, so the group can establish relationships with each other without new faces every group. Your nurse will show you a short video about centering today. Your nurse was also going to order your ultrasound. You will receive a letter with your ultrasound appointment within the next 2 weeks. If that time does not work, call Duke directly to reschedule. If you bring a child with you to that ultrasound, you must provide adult supervision to care for your child. No ultrasounds are provided here. Typically, mom gets ultrasounds around 12 to 14 weeks, and then again at 18 weeks, unless for some health reason you need more or you need it sooner. You may have applied for presumptive Medicaid this morning, unless you already have Medicaid. Hold on to any paperwork you did today because it will cover you for this month and next month. Take it with you to your ultrasound appointment because it will ensure that you don't have to pay out of pocket. You do have to apply for pregnancy Medicaid in person in social services. They accept applications every day except Wednesdays. It's in the same building, just on the other side in lobby 9 and 10. It can take 30 days or so to receive Medicaid approval, so apply for this as soon as you are able. If for any reason you do not qualify for pregnancy Medicaid, we offer our services on a sliding scale based on your household income. You will have to make arrangements with Duke to cover ultrasounds and labor. You can plan to have your baby at Duke University or Duke Regional Hospital. If we identify that you are experiencing a higher risk pregnancy, we would recommend that you deliver at Duke University, just for you and your baby's safety. If you have a boy, you must decide whether you would like him to be circumcised. It is an optional surgery, and I would encourage you to talk to your provider about the benefits and risks. It's best to have that conversation before delivery so you are already prepared when the time comes. It must be paid in full before surgery is performed, $350 if under 2 months of age or under 12 pounds. If you are going to have it done, it's best to have it performed prior to being discharged from the hospital. If you ever have a prescription, it is going to be cheapest to have it filled here. The Durham County Pharmacy does not take outside prescriptions, however. We also have dental services for our expectant moms. All expectant moms are eligible. You just must enroll before 24 weeks. You can make an appointment by phone by calling 919-560-7680 or visiting the lobby in person by going to Lobby 21. Don't wait until you have a toothache before you have a first visit. We don't want you walking around in pain, and research shows that the health of your baby's teeth and gums are important for baby's development. The nurse will give you a list of all of our important contact numbers. Take a screenshot of this list and share with your support people. She will also give you a list of many over-the-counter medications that are safe to use while pregnant. If you are using one and it's not working, please give us a call. It's not a bad idea to call and check before you start taking one at all. There are a few precautions to know about during your pregnancy and reasons we would want you to call the clinic. It's important that you always wear your seatbelt and avoid exposure to any alcohol or drugs, including secondhand smoke for tobacco or electronic cigarettes. No amount of these substances are known to be safe during your pregnancy, and many are known to cause preterm labor, low birth weight, and other complications for mom and baby. It's also important to avoid hot tubs and saunas and to stay nice and hydrated in the heat if you exercise. Pregnant moms should take caution changing cat litter and working outside in the garden where cat feces may be present. This could expose you to a bacteria called toxoplasmosis, which can be especially dangerous during pregnancy. If you must do these things, be sure to wear gloves and wash your hands well afterwards. If you ever notice vaginal bleeding, leakage of fluid, or a sudden gush of fluid, preterm contractions, or a decrease in your baby's movement, we would ask that you contact the clinic or one of the on-call emergency numbers right away, or go to the nearest emergency room. The nurse will also give you a list of pediatricians. In your spare time, go through this list and try to identify an office you are interested in visiting. Contact them and let them know that you are trying to establish a provider for your new baby. Try to do this before your baby is born, because your baby's first appointment is scheduled prior to being discharged from the hospital. That way, they can schedule it with the provider you have already chosen. Next, you're going to hear about nutrition and pregnancy. Then the nurse is going to go over all of the paperwork with you, and they will talk to you about your health history. Please share any questions or concerns with her. Congrats again.